Welcome to my semester 2 placement debrief.
Hey, it's me.
Hello everyone and welcome. This has probably been one of my most requested videos ever. I've got my cuppa, I've got my little chocky bickies, and we're gonna just dive into it. It's 10:30 a.m. It is Friday, my day off. I am sitting in my comfy clothes. I have my favorite pajama bottoms on. I've taken Arthur to school this morning, picked up some meds. I went and got a coffee. I went the long way and drove around to get my favorite Yahava coffee because they also half-price coffees. Clearly I need the coffee. Half-price coffees for the next 2 weeks if you order it through the app, which is how I order my coffee anyway. So let's get down to business. This week I started semester 3 of my EN Diploma here in Perth, Western Australia. I'm studying at the Institute of Health and Nursing Australia, so IHNA, as most of you may have seen it. I am a big semester 3 gal now, and I am also 18 weeks pregnant today. Do we want to see the bump? She's adorable. Look at this. 18 weeks pregnant. Amazing. So I thought what we would do, I've got my handy dandy notebook here from placement, and I thought let's just go back to the beginning of March and let's just talk about it. I figured we should probably start with organisation for placement. What things did we prepare beforehand? What did we need to know? What do I wish we knew that we didn't know? And I guess like just some tips that I can give you on, like how to best prepare yourself. So I guess first and foremost is you would be given your allocation for your placement. By that stage, congratulations. I hope for you that you have been given a place that you're going to learn, you're going to flourish, you're going to love. It's going to challenge you, and remember that our best parts of our growth through life are not in our comfort zone. So if you're a bit scared because of where you've been allocated, don't stress. You are the student, you are the baby. These are the best times of our life where nothing is our fault. We are there to learn, we are there to observe, we are there to grow and to become the best version of ourselves, and to firstly get a taste of what it really is like to be a nurse, because your stage 2 semester 2 placement is your first hospital placement. So by this stage you've received your allocation, you know where you're going. What are the first steps? What do? You do some Googling, you do some research, you research the hospital. If you aren't familiar with it, you do some research on the ward that you're going to, you see what they specialize in. All of this information is available very easily on the hospital's website, through Health Direct, all of those things. You find out, what kind of patients you're going to be working with. So as an example, I'm going to insert my information here. So I was placed at Royal Perth Hospital. It is the biggest state trauma hospital in Western Australia. And the ward specifically that I was placed on was gastro, neuro, and stroke. So a massive mix of patients. So I knew that I needed to be very, very comfortable and very confident in doing my vital signs and observations, neurological observations and assessments, BGLs, all of the things that you should well and truly be comfortable with as a stage 2 EN student. So you've been placed, you've done your research on the ward that you're going to, you're feeling a bit scared, a bit nervous. Reach out to the public. There's a lot of nursing forums on places like Facebook. You can post in there and introduce yourself and ask if anybody works at that hospital on that ward. Has anybody worked there before? Is there any medicines that are going to be used? This is exactly what I did. And somebody said, message me, I've worked there for years, I'll let you know. And I chatted with this person for days on end about the kinds of patients I was going to see, the things I might experience, the main medications that they use, the medication treatment. A lot of alcoholic patients end up on these wards, a lot of drug withdrawal patients. There is a lot of albumin treatment, a lot of thiamine medication, so things that we might not have been familiar with. So firstly, doing your research, reaching out to different people, speaking to your other nursing friends, you know, just familiarizing yourself so it's not a huge shock to your system. And again, practice doing all of your neuro assessments, all of your vitals. And yeah, that was probably like the first big part of, you know, preparing and getting ready. So you've got your placement allocation, you know where you're going, you've done your research, you are familiarizing yourself with some medications that are used to treat those sorts of patients. You know, you're familiarizing yourself with the stroke protocol. You know, you're familiarizing yourself with the kinds of things that enkephaleptic patients might be going through. You know, again, put your own information in here on where you're going and what you're going to be doing. So you've gone through your exams, you are finishing your Oscar paperwork, you are handing everything in, you are making sure everything is submitted, ready to go, so that when you go on placement, you've got nothing to worry about. Then you want to start preparing yourself. What are you going to take? What are you going to use? What sort of tools are you going to need for the job? At this stage, as a semester 2 student, you should well and truly have everything you need. Some things that you think you need that you might not need for placement are things like your sphygmomanometer. You won't need this. They have lots of them in the hospital, but most of them these days are actually one per patient, so they're reusable. And then once that patient is discharged, it goes in the bin or they can take it home. Your stethoscope, I took this, I did not use it. They have manual BP machines everywhere with one-time use stethoscopes, but again, something you keep in your bag because not every hospital is the same. Not every hospital has the same budget. You may still need your stuff. Some things that are in my bedroom and not here with me. Your nursing pouch. Making sure that your nursing pouch is equipped with, first and foremost, minimum of 3 pens, specifically black because you write in black, blue at a minimum for a backup, and red just in case, but at least 2 black pens that work really, really well. Highlighters. You will carry a black pen and a highlighter in your pocket every single day. Why do you need a highlighter? You need a highlighter for handover because when you are assigned your patients, you want to highlight them on the handover forms. You want to highlight any important information. And that's just in the big group handover. You haven't even gotten to bedside handover yet. So pens, highlighters first and foremost. You want to be wearing a fob watch, a manual fob watch every single day. When I say manual, I mean a analog, a little, I really should be having all my bits and pieces here, but I feel like you should know. Just a little watch face that has a ticking hand because things die, watches die, Apple watches die, your phone, you're not allowed to use your phone. I had a lot of people comment on my TikToks going, why are you wearing 2 watches? It's so weird. I can't get my head around it. The funny thing was I did a massive mixture of shifts where I would go from working to 9:30 at night, I would get home, it's midnight, I start again at 7 o'clock in the morning. So sometimes my Apple Watch hasn't fully charged and then so the next day it's gonna die halfway through my shift. So then what am I gonna do? I also forgot it one day. I had my fob watch in my nursing pouch as a backup. You can buy your little fob connectors for your Apple Watch and people are like, oh my God, it's so good once you get to the hospitals because you can just wear your Apple Watch. Literally not one person in this hospital was wearing an Apple Watch. Everybody had them connected to their shirt because it's bare below the elbow. So everything that you learn is legit. There might be some hospitals and facilities where you're allowed to do that. That's totally fine, each to their own. But the amount of times you are washing and sanitizing your hands, a watch is just in the way. So you've got your pens, you've got your highlighters, you've got your fob watch and your Apple Watch or whatever, just your fob watch. You want to have your name badge that states that you're a student, very up, clear, front and center. You want to be wearing your student ID on your thing with like a little badge reel. If you don't have one by this stage, go on Etsy, go on eBay, go on Temu, whatever. They're so cheap. But it is a part of A, looking professional, B, being able to be identified by anybody who questions who are you, why are you here, why are you not in Royal Perth uniform. It happens. People ask, I've never seen blue scrubs before, where are you from? Oh, you're a student nurse, beautiful, welcome, love that. You know, and then from there, like that's probably like your main minimum necessities. And then from there, it's adding in any extras that you think you might need, like a spare highlighter, having Panadol in the little zip pocket of your nursing pouch. Any medication that you might need. I was 10, 11 weeks pregnant. I was taking ondansetron. I was scoffing that stuff like a bitch because I was so sick. I had ondansetron wafers in my purse because in my nursing pouch, because even though I could have taken metclopramide, feel like I'm saying the wrong drug, but anyway, there was another one that I could have taken that was just one a day and was orally. I didn't want to take it if I didn't need it, so I wanted to have a preventative measure there for if I started to feel nauseous, I was able to relieve myself. So ondansetron wafers were my go-to. So I ripped half a sheet off my packet and I had it in my nursing pouch, because if I'm running around and I'm like, oh my gosh, my BGLs have dropped, because that happens to me, I get really hypo, I need to be able to quickly take something there and then. I might not have access to my water bottle straight up. So just using your brain, if you need to take meds, making sure that you're eating before your shift, you're taking your medication so you're not having to think about it halfway through your shift. Obviously, if you take specific medication that needs to be taken at a specific time, that's fine. You'll just excuse yourself, hey, I'm just going to quickly run to my locker, I've just got to take some meds. Literally no one cares as long as you tell them what you're doing. I also carried my notebook, obviously, and I had a printout of my scope of practice on A5. So like you can print 2 to a page and it comes out A5, and I cut that in half, folded it into a little square, and I put that in my nursing pouch. I was well and truly aware of what my scope of practice was, but in case I came across a nurse who said to me, you should be able to do this, or you can do this, why can't you, blah, 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 I would go, actually, no, sorry, darling, I can't. And that did happen. We had quite a few incidences. Somebody got reported because they were trying to make us students do IV stuff and take cannulas out, and that was not in our scope. What else? So we've got our nursing pouch sorted. Now, I will say this. I prepped and packed my nursing pouch, but I left my nursing pouch in my bag every day because the nurses are happy for you to run to your locker and get medication if you need it, go for a toilet break, go and have a quick snack, whatever. Like, you're a student, you're not getting paid. So they're like, go and do what you need to do. Like, that's fine. Just report back to us when you're done. I obviously, being pregnant, you know, come that second week, my pants had started to get tighter, my hips were sore, my sciatica was playing up. Having a nursing pouch around my waist was just too much for me. All of my scrubs have amazing pockets. So I would have a pen at the top, a pen in my pocket, scissors. Have your own pair of scissors. On my second shift, I was with an older generation nurse, and she said to me, empty your pockets. I emptied my pockets, and she said, yep, you'll do. And I was like, what was that all about? And the other girl goes, you've got scissors, you're gonna be a great nurse. And you know, I don't know if that was just funny, like an initiation thing, but anyway, having your own scissors, because you need to cut ID bands off, you'll need to cut tape, so many little things where people are just like, has anyone got scissors? You've got scissors, you will save the day. What else? Yeah, so scissors in your pocket. You can get like little plastic, you know, like when you buy a new pair of tweezers, they always have like a little protective tip on the end of them. I always keep those and I use them for my scissors. So put that on your scissors so you can keep them in your pocket and make sure that they're not obvious. Like, some pockets have the little elastic inserts inside your scrub so you can stand all of your things up. But if it's obvious that you've got scissors in your pocket, that can obviously be a, you know, a risk. So don't do that. Someone can grab them and stab you. I never saw that happen, but I was told about it. So anyway, scissors, pens, you're gonna end up with your pockets full of crap by the end of the day. I have a TikTok video that went viral, and it was literally just me emptying my pockets after my first week. The storerooms are obviously very full of all of the things, so don't stress, there's scissors and stuff everywhere. But if you have your own, you don't have to worry about running off and trying to find things. You should have the minimum tools required to do your job, and that would be a pen, a highlighter, a pair of scissors, your fob watch. Carrying some extra gloves in your pockets. It's not super sanitary. Obviously, you wouldn't do that with sterile gloves anyway, but the amount of times I would be coming down the hallway and the bathroom emergency buzzer starts going off, and it's because somebody has literally defecated themselves, and there is literal shit everywhere. And sometimes I did actually recommend to them that they should have a set of like gloves on the walls in the toilets, not outside on the wall out there, because sometimes someone's just pressing a buzzer to let you know that they're back in their chair and they're ready to be back to their room. Other times there is literal shit everywhere, and then you're like, shit, I need gloves. So I always kept like 2 pairs, one in each of my little side pockets. I think that's probably enough about like your minimum tools and preparing yourself. But anyway, like I said, nursing pouch isn't a requirement. It is completely up to you. Most of the nurses there do not use them because they've been doing it for so long. They literally have a pen, a highlighter, their fob watch, their Apple Watch, they're good to go. Oh, and a notebook, obviously, that is super essential. And most of them will still have that because you'll carry around your handover sheet as well and you want to take notes. Okay, where to from there? Okay, so you've got your uniform organized, you've got your tools organized, you've rocked up on the first day. What else is reference cards? Okay, let me just go and get some stuff. Okay, I have some goodies. Another thing that was super useful that I actually did open quite a few times, my little Essential Aussie Drugs book. Now this one also is the latest edition and it has all the tall man lettering in it, which you will see written a lot. So it's easy to explain what it is. This was just great for when things were going a bit crazy. Doctors were charting meds and going, she needs, IV, ABs, stat. So they're changing things over and giving them new antibiotics. And I'm looking at it going, wow, I've never seen that one before. What is it? What does it do? Oh, that's awesome. It's a blah, blah, blah type of antibiotic. So it was just really cool for that. There was also times where, I would be giving a med and realistically you aren't supposed to give a med if you don't understand what it is and what it does. So sometimes I would say, hey, I've not actually given this med before. Can I just have a quick look? I just want to make sure I know what it's for. Or I would write it down and I would do my research later. So this was really, really great for that. And it's so small and tiny, it just fits in your scrub pocket. If you buy your nursing kit from enurse.com, most of them will come with this in it. If not, pick the one that comes with it because it is a super essential piece of resource. Basic things, name badge, like I said, you can get them off Etsy, get them made anywhere. I just have student nurse written on mine because obviously when I go through to uni and stuff, I'll then be a student RN, not an EN, so I just didn't want to put my role on there. Apple Watch fob watches, same thing. I got these from eNurse for about $5 or $6. They are amazing. Slide onto your Apple Watch, clip onto your shirt. A analog fob watch, which is what I was showing you before. Okay, reference cards. I had the set from the Prepared Nurse Co because I got them for my birthday. Would I buy them again? Yes, I would. They are amazing. They are on like smart writer material, so they do not break, they do not wear, they do not disappear. I went through based on everything I'd learned so far on my scope and I made sure that because the pile I have is probably double that. I just kept everything on here that I needed. Did I use these on placement? Maybe once or twice, but the fact of knowing that I had them there if I needed them right on my pocket versus being asked a question and not being able to answer it, I loved that safety of it. The main things were things like common abbreviations, wound assessments, nursing progress notes, that one came in handy. Isobar handover, didn't really do it that way anyway. Diabetes management, med calcs, just in case. I've never really had to do any med calcs there, but they did ask us questions. ECG interpretation, that card I thought would come in handy, but we didn't do a lot of ECGs on my ward. Head to toe assessment, just things to remember, and then a PQRST pain assessment with adult vital signs. They were amazing. So again, I could thin that lot out because there's a lot in there that I didn't refer to, but I might need them on the next one. Something that is also super handy, my mini proper Sharpie that came with my Prepared Nurse Co cards. That thing comes in handy tenfold. If someone's doing a urine sample or a stool sample or something and they've rung the bell and they've called you, there is cups there. You can take the cup, do what you need to do, and then there is a bag. But then imagine you're walking back to their room, you've got to then get a sticker and label both things. So being able to just quickly write bed for or their name or something on there whilst you can was amazing. My ampoule opener from eNurse, I actually didn't use this on placement. I did give it to one of the other girls to use. They were like, that's so cool. But a lot of the stuff was already like either pre-drawn or it was plastic squeezy bottles or yeah, I don't know. I just didn't really find myself reaching towards it. But again, I'm so glad that I had it if I did need it. Now, having a really strong badge rule for heavy things like this is imperative. Where did I get this one from? I have the Nordace backpack that I use for nursing school. This came in there for you to clip your car keys to this part and clip this inside your bag so that you didn't lose it. It is the strongest badge rule I have literally come across, because I use all of these like really cool fancy ones that I've had made and bought, and they hold a lot of stuff. But if I was to put all of this onto that one, it would literally sit like this. So anyway, amazing. Then a badge rule, like I said, you don't have to get fancy ones. You can just get the ones that are just the plain plastic. You can get them from Officeworks, eBay, Etsy, whatever. I have some amazing ones. This one specifically is from Badges by Carly. I have quite a few from her. It says coffee scrubs and rubber gloves. That was one of my favorite ones. I always reach for this one. So that's all of that. Notebook. Okay, something that literally saved my life. I did night shift. A lot of students don't get to do night shift. I got to do night shift, something that I organized months before I was going on placement, knowing that I may be doing night shift and that I'm blind and that I don't want to annoy patients, was this amazing little night light from Nurse Chill. Now they're literally like $20 if that. Get a few of your nursing friends together, do an order, save on shipping. It literally, you pull the end off, the little rubber end, and that just slides into any USB that you have. For me, I have USB power points built into my house, so I just, when I remembered, shoved it in wherever, and then that obviously just goes on there as a cover. It has 3 settings, so a small light, a brighter light, and so it starts on super bright, medium bright, low bright, and then emergency, met call, I'm running, get out of my way. I never used that, but I accidentally left it on once and someone said, you're flashing red, what's going on? But anyway, every single nurse that saw me using this on night shift was like, what is that? I need one. And I mean, if I was made of money and I was getting made for placements, I probably would have done a big order through Nurse Chill and gifted these to the ward, because they are incredible. It literally just slides over your clothes. Sometimes, because I was getting so much fatter, I had my scrub shirt tucked into my pants, so then I just had this over the top of where my pants sat, and it was great. I would wear my Scrub Lab vest at night, as it got colder, and obviously I wouldn't zip it all the way up, so I would just stick this in where my zip half was, or there's a little zip actually on my vest, and this was perfect. It just like slid in there and it sat there. Patients loved it. They're like, that is so great. I'm so happy you don't have to turn the light on. Obviously I didn't want it shining in their faces, and so sometimes I did just actually hold it in my hand so I could see their charts. Or if I walked in and I was waking them up, I just kind of kept it covered a little bit and was like, I have a little light. I just don't want to make sure it's in your eyes. Everybody loved it. Everybody asked me about it. Amazing. So thank you, Nurse Chill. Sue is amazing. So you should definitely get onto one of those. So they are some things that can help you. You don't need to have them. They are just things, because I am a thing lover. Did I have anything in here? Yes, something else. Something else that you do not have to do that I did. You'll notice that all of my stuff is well and truly labeled. That is because I am a stickler for not losing my stuff. Literally everything has a label. Everything is labeled. I would label myself if I could. That's called a name badge. So what are they? They are proper labels from a place called Tiny Me. Now you can get them from lots of different places, Etsy, all the rest of it. What you need to make sure is that they are like waterproof. Okay, the way I found them was because my son goes to daycare. When I was getting him ready to start daycare, someone said to me, make sure his stuff is always labeled. So I knew I wanted to get one of those like clothing stamps with his name. And when I found that, they were like, what about like water bottle, shoe labels, all the rest of it? So I got them for him, and everything that I buy him now, we label it. So if it goes to daycare or we go to a picnic or whatever, people always know whose it is. So coming into placement, I knew that I wanted to label my stuff. So I remembered and I went on there and I got some sheets of labels made. They have all different sizes. You can pick like a pattern of design. So you put in that like, I like pink, I like flowers, I like the ocean. And it just gives you a bunch of random printouts, different sizes. These ones are the pencil name labels. So again, you don't have to use them for pencils, but they were good because they were longer and skinnier. I could wrap them around my pens. Literally everything I took was labeled. Did I lose anything on placement? No. Is it because it was labeled? Maybe, but a few times people picked up my pens and borrowed it, and I'd go back on the next shift and they'd go, hey, I have your pen from yesterday. Imagine if it wasn't labeled, they wouldn't have known it was mine. They also sent me this iron-on labels sheet for free as well. So like I could use these for my scrubs or like whatever. My jackets, because sometimes you take your jacket off. But these, I believe, just iron onto your clothes. So they're really cool as well. So again, another thing that was amazing for me, I did get bag tags. Do I have them down there? No, they have heaps of little things that you can add on. You can do like a little package. So they had like a bag tag. So it's like a circle with your name and one of the designs. They also did like big stickers. So I got some of those for like my Yeti, my other water bottle. What else did I label? I think I had like my portfolio. I put one on there as well. Just made sure that everything was clear that it was mine, because there was times where you would be sitting in the doctor's office and you would be using your books and doing things, and then all of a sudden you'd get called out. There was a bell, and then, you know, people would come and want to use that computer, so they would just move your stuff to the side. So rather than people being like, "Here's crap, is this everywhere?" they could see that it belonged to someone. I think that was it as far as all of that stuff went. I also made sure I packed in my bag deodorant, a spare scrub top, a change of socks. Don't ask me why, but I wore my Crocs and my Birkies, and sometimes your feet do still get wet. So a spare scrub top. If you get soiled at work and you don't have a spare change of clothes, you have to go down to theatre and get like the theatre scrubs, and then obviously you have to give them back at the end of the shift because they scan in and scan out, which is fine. But I was just like, I would just rather have my own student shirt again to be able to wear. So I took spare socks, a spare scrub shirt. I made sure I had deodorant. I made sure I had like wipes for my face, a nail file, nail clippers, because sometimes like I would cut my nails to start and then 3 days later they look like this because I'm pregnant. So I would quickly sit there and trim my nails down because they are pretty big on that. Just, you know, making sure that like I took my iPad and I made sure it was charged, because if there was downtime on some of the shifts, I could sit and do my schoolwork. Making sure you take a phone charger because some of the shifts are really long. So, you know, just if you need that. Taking a book, it's nice to sit and just like, you know, read a book on your breaks. Lots of food, lots of snacks. I didn't just take lunch every time. I took morning tea, I took lunch, I took an afternoon snack. I had made sure I had things to eat on the way home, not just because I was pregnant as well, but you are on your feet. I didn't do any less than between 10 and 12,000 steps on a quiet shift, and up to 15 to 25,000 on a busy shift, and night shifts as well. So you will be moving. Lots of coffee. There's coffee shops in all of your hospitals. They do like, you know, coffee and tea for staff and whatnot as well. They usually have milk and everything. So, you know, bring cereal, things like that. What I did was I packed like really basic stuff for the first day. I knew I would have access to at least a microwave. So if I needed to heat my food up, that was fine. I took really basic snacks. I took extra things to drink, some juice, a protein shake, whatever. Then I studied the field. I was like, perfect. We have a sandwich toaster. We have a coffee machine. We have fresh milk. I can make cereal. I didn't like the tea. I didn't like the sugar because I am very fussy in particular. So I took 2 little containers, one with my own sugar, one with my own tea bags. I packed a teacup in my bag every day so that like I could keep my tea hot and leave it in the doctor's office and just go in between. My water bottle, making sure you've got water bottles. Just, you know, things that are going to help get you through. Lots of lollies. I had lots of like I went and bought like a big party size lolly bag, and I got like little Ziploc bags and made up like 5 little bags. So for each shift I had a little bag of lollies. You know, little things I could just shove in my pocket and like just quickly eat as you go. So again, you don't have to do this. This is just what worked for me. There is canteens and stuff in the hospitals. You can go buy a chocolate bar, whatever. So just making sure that, you know, I'm a very rather have it and not need it kind of person. So that was that. Okay, so you've set up, you've sorted yourself out, you've started prac, you've figured all the things out. For myself, I had like a sales spiel organized. I had this big conversation with my husband before I started placement, because he said to me, what are you going to do if you get put with like a nurse that just clearly can't be bothered and doesn't want students? And I said, I'll ask to go with someone else. And I would do that. I'm that kind of person. I'm there for a reason. If you don't want to work with students, don't work with students. Put me with someone else. I was very lucky. Every single person on my ward was happy to have a student with them. By the last week, people were fighting over me. It was so funny. I would go in and people are like, oh, come with me today. And like my name's already written on the board and someone's like, no, she's with so-and-so. And then someone's like, yeah, she's with me today. And then they're just like, oh, you're so lucky. I want her. And I was just like, guys, stop it. Like, I'm so flattered. It was really sweet. I really felt like I worked there. I did not get made to feel like crap or like I was not welcome once on that shift. Even when things got hectic, I wasn't in the way. No one made me feel like shit. And again, I'm speaking about my experience and my facility, not everywhere else. We've been back to school. People have had bad experiences, but a lot of it is that they didn't exert themselves and didn't make themselves, like feel like they were part of it. They were just too scared, and that's fine. Not everybody can advocate for themselves, but the sooner you learn to do that, especially as a nurse, I think the better off you'll be for it. So at the start of a shift, you would go in, we would check the board, we would see whose name we were next to. If it wasn't written on the board, we would look in the roster, it would be written in the roster. Your shift is, say, for example, 7 till 3:30. You would make sure that you were there at 6:50 a.m. so that you could put your stuff down, make yourself a cup of tea, put your food in the fridge, and then get your pens and everything else that you need and get to the handover desk and have your handover sheet ready to go. Know who you're with for the day. You might be scheduled to bed. So again, I'm using mine as an example. So the whiteboard would have down the side who the coordinator for the shift was, who the second in charge was, if there was another one, like if that person was on lunch. Just anything that you sort of needed to know. So ours were broken up into rooms. So it was like A was a separate room. A, B, C, D were all separate rooms. E had 4 beds. F had 4 beds. G, H, and I all had 4 beds. L, M, N, and O were all individual rooms. So, it was like, it didn't mean because it was an individual room that it was quite a work. They were high-risk patients. They had trach tubes. They were alcohol and drug withdrawal patients. They were aggressive, they were restrained. So, it was wild. It was so insane. So you would look and see which rooms do you have. Perfect. Start flicking through your handover sheet, highlighting the patient's names next to the rooms that you have. Start looking through it, highlight any little things that you think you might need to know. Then listening. The coordinator would do handover and would tell you how many beds you were open to. So I think this ward was like a 28 bed ward. And they would go, we're open to 28. We've got 24 patients. We've got 4 empty beds. So expect some admissions, rah, rah, rah. And then they would go through the shift and talk about each patient really quickly. He's going for this today. She's had that today. He's post-op recovery. He's in for this. He's waiting for that. She's doing this. And then they would talk about, like the high risk patients and what they needed. So those patients had AINs that worked the whole shift with them. So you would just be familiar with what the days looked like. Anyone that's passed away, anything like that, you would find out at that point, which could be sad. But you would just have to get on with it. So then from there, we would go and do bedside handover. We would go with our buddy nurse to the rooms, and we wouldn't specifically stand bedside with the patient. We would actually stand outside with the other nurses that have looked after those patients for the days. We would go through their files. You would have a time planner out. They would go, this patient has meds at 6, 8, 12. BGL's at this time. She's got an OT appointment then, rah, rah. And you would plug all of that into the time planner. The nurse from beforehand would, hand over anything imperative that we needed to know, any important information. Have you worked with this patient before? No, this person was a new admission today. So they would familiarize us with that. They would do like all 4 patients, and then we would go in and we would say, "G'day, Susan. My name's Hayley. I'm your student nurse today. If you need anything, please let me know." My RN would introduce herself. This was something that I did. A lot of the other students I found would just stand there really quietly, and they would hope and pray that their RN would introduce them and say, "She's going to be working with us today as well." So I made myself known. I was like, I'm there for the shift. They're going to ring the bell. I'm going to be the one coming and getting it, not my RN. So they need to know who I am, that they can rely on me. Then we would all go to like the med storeroom, and we would put them up on the whiteboard, and we would look at our plan and go, perfect. You can have these 2 beds. I'll do these 2 beds. Do you want to just work together? We'll just do it all together, whatever. So, it's about being proactive. And at that point I would go, if I hadn't worked with that nurse yet, or I hadn't met them, I would then at that point go, probably on the way down to bedside handover, they would be like, how are you finding it, right? You would just have small talk. And I would go, Look, obviously this is only my second placement. It's my first hospital placement, but here's everything I'm confident doing. There's nothing that I'm not really confident with, obviously, unless it's not on my scope. So if you need anything, please let me know. I want to see all the things. I want to do all the things. And they would go, great, perfect, just what I want to hear. So, you know, they would go, okay, great. She's confident. She's happy to do this, rah, rah. I think I was doing like between 3 and 6 subcut injections every single shift, because every time I saw on the thing that someone needed a subcut, I would go, perfect, can we make sure that I get to do that? Yep, perfect, no worries. If I saw that other teams had like, you know, IDCs that needed to get put in, I would go, can I go and watch that procedure? Yep, perfect, no worries. So it was just about voicing how confident and comfortable I was to do X and Y, and then going, hey, can I also go and observe this? Because that's where I don't feel comfortable, or I want to see how they do that. On my last day, literally in the last 5 minutes, I got to do a measles vaccination. So an intramuscular injection, which we didn't think we'd get to do. And that was scary, but it was amazing. And I was like, great, I've done it all, I can leave now. And again, it was just because I heard them talking about it in handover. So I went and said, hey, is there any chance you guys would be happy for me to do that IM? And they said, as long as the patient's happy, you can do it. And I was like, amazing. Wasn't even my team for the day. So having your own sales spiel, feeling confident and comfortable to say what you are confident and comfortable to do and what you aren't, what you need more help with. When it's quiet, they'll say, is there any skills you want to practice? Don't go, no, I'm just happy to like do whatever you guys want to do. I would go, what do you want to show me? I want to do wounds, let's do this. So wounds was the only thing there wasn't a lot of on my ward. And so we actually had a patient who was like admitted 3 times in the 3 weeks I was there, and he always had lots of wounds. So I got really friendly with him. So on my last week, I was like, hey, Mr. So-and-so, would you be happy for me to do like 3 wound changes on you? He's like, yeah, go for it, whatever. So that was great. And that was just about me chatting to them and, you know, again, voicing my opinions, knowing what my goals were, knowing what I needed to get done. And I knew that I wouldn't get those things done if I stood in the corner quietly and was like, I'll just watch. That's just not me. It's just not who I am. I can't stand still. So it's not me being hot-headed and over the top. I am still a very humble person. I'm just like, look, like I'm a baby. I haven't done this before, but I'm really excited to do it. And they would go, yeah, perfect, no worries. I didn't want to be all like, oh, I'm so scared. Can you just do the first one and I'll watch? If it was something that I genuinely hadn't seen before, and we'd only done once or twice at school, I would go, you do this one and I'll watch just to see how you talk to the patient and what you do, and then I'll do them from here on out. And they would go, yep, great. So same as with the subcuts. The only reason I didn't do it when they asked me if I wanted to do the very first one on my first day was because we practiced drawing up with syringes and ampules, and all of the Clexane injections in this hospital were like the fancy retractable ones. They're already drawn up. They have air bubbles. You have to do this, rah, rah, rah. And I was like, I'm comfortable to do it, but I actually have never used one of these before. So could you just show me, and then I'll know from there. And I'm so glad that I did that, because then when I did go to do it, I felt more comfortable knowing that I had to push really hard at the end for the sheath to retract, and, you know, like, rather than standing in front of the patient being like, I've never done this one before, I don't know what to do. So yeah, it was just really about doing that. Okay, so, you know, I could sit here for hours and keep going on and on about things, but I know you guys just want to hear the juicy things. So did I see anything crazy? Yeah, I did. I had a poor patient that came in, and unfortunately, he passed away before I finished my placement, and I didn't expect that. So that was really hard, but I'm glad that I got to be part of his care team. You know, watching them decline over that time can be really, really hard. So you do need to prepare for that. You do need to talk to your peers. You know, you do need to speak to your nurses and stuff about how you're feeling. You can come and have a cry. You can do what you need to do, because you can rock up tomorrow and someone just might not be there, and that can be really hard. So yeah, I had patients that were there for the whole 3 weeks. I had patients that were there for a day or two. I had patients that weren't even there for a full day. They were admitted, came up, had a camera or scope done, and then they were gone. So yeah, it was really like up and down each day. Met calls. What do you do when a met call happens? Well, for starters, you get out of the way because you don't know what to do in that instance. But things like familiarizing yourself with the resus trolley, so that if a met call happens and they're like, grab the trolley, you can at least grab the trolley and pull the wire off. They have like little clasps on there that have to be, you know, they have to go through the resus trolley and lock it with this little wire cable so that they know that it's been restocked and that nobody has taken anything out of it. And that needs to be ripped off so that the trolley can be opened, you know, ECG can be done, everything's good to go. So like I grabbed the trolley once and ran down to a room and put it in there, and then they were like, it's a carded room, so please just stay out and you can just observe from there. I was like, yep, that's fine. Met calls didn't always mean that somebody was going into cardiac arrest or dying. It just meant like they could be crashing. There was lots of different things. There was one where we were like, a patient had a met call 4 times in that one shift. And he was like, am I gonna die? And we're like, no, like, it's okay, we've got you. It's just that he'd had surgery and for whatever reason, his blood pressure just kept completely dropping. So, you know, he ended up like going up to ICU or something. They have machines called Hive, which are fully monitored 24/7. So the patient is hooked up to them next to their bedside, and you don't have to go and do their obs every 4 hours or whatever, because it's constantly being observed. And the Hive team will ring and go, hey, your patient in bed B is, you know, O2 sats have gone down or whatever. Can you just check, make sure the cables are on? So, you know, they were completely monitored 24/7 because they needed to be. So there's lots of cool things that you got to learn and see. But yeah, so when it came to met calls, yeah, it was scary. There was actually a lot of code blacks more than met calls, and code blacks could mean aggressive patient trying to abscond. So security would just come from anywhere. Like they would call a code black and there would just be a team there. Like they were great. They responded so great every time. So again, you just like didn't rush down to where everything was. If you didn't need to be there, don't go near there. Like it's got nothing to do with you unless they call you to go come and observe or whatever. So if it was a met call on a patient I was with, I did have to press the met call buzzer once, and that was insane because like, again, the reaction time was like that. And everyone was like, great thinking, like critical thinking. Yeah, because a patient out of nowhere that had been completely stable just started like coughing up blood and blood coming out of their nose, and it was wild. It just went really downhill really quickly. You know, so I don't know, like I saved that patient's life, you know, they got the care that they needed. And that person was actually admitted again before I left as well, which was annoying because I really hoped that they were going to recover well. But yeah, so I guess familiarizing yourself where the storeroom is and familiarizing yourself what's in the storeroom. So, you know, the way ours was set out, it was like catheters, IVs, all of that sort of equipment. And then this side was like healthcare, wounds, you know, dressings, all of that sort of stuff. You know, they had everything down to like razors and shampoo and soap and all that sort of thing. So yeah, just familiarizing yourself. So someone's like, run and get a blah, 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 blah. You know what you're getting. Knowing where the equipment storeroom is. They might need a pump and a pole straight up. They might need another wheelchair. They might need a weight chair, whatever. So just being able to confidently say, yes, I'll go grab it. Not if you don't know where it is, you say like, I don't know where it is. I'm going to waste time, and they'll send someone else. So yeah, I just sort of stood back and observed all of my met calls. Nobody passed away whilst when a met call was called, none of them ended really badly, but those patients were very ill, and unfortunately some did pass away before I finished placement. So yeah, you just never know what each day is going to bring, but I don't really know what else I sort of want to go into detail about. I think like my biggest advice is just to be proactive, ask questions, you know, put your hand up and go, yeah, I'll come with you and come and watch that. You know, in the quiet time, don't just stand around and sit around like everyone else does. Go into the storeroom, familiarize yourself with things. You know, read up about meds, ask them to read policies and procedures on their hospital about how they do things. That's a great way to learn as well. Reading through the files. So our hospital has a nursing folder and a doctor's folder. So, you know, the nursing folder we've got access to 24/7 because we're charting and doing things. The doctor's files get kept in the doctor's office. You can go and get them as much as you need because that's where you write your progress notes. So being able to go through and like read those things, it's like you're familiarizing yourself with what this patient's been through because it's got their whole history in there. You know, and it's a great way of learning. It's a great way of being able to like depict and break down like, what are these doctors writing? What do the things say? Googling any words that you're not sure about. you know, just really make the most of it. At the end of the day, like, you are there unpaid, but you're still there to work. And so you need to utilize that time as best as you can. I don't really know what else I want to tell you or talk about. I took my ward just like a little gift on the last day. I baked for them and took them some Easter eggs and stuff, and just wrote a card to say, like, thank you so much for having me in your space and for giving me your time. You know, you don't have to do that. You know, you might have a bad experience and go, I just want to get the hell out of here. But if you really did enjoy your time and your people were great to you, like, just a tiny little gift on the last day, or even just a card to say, thanks for having me. I hope you guys remember me. Like, you know, I'll hopefully see you in a couple of years. I also like really spoke to a lot of people about their experience so far, and like, how was your journey into nursing and stuff. You learn a lot, and working with the older nurses as well, it can be a bit scary because they're very like drill sergeant down the line, but you learn a lot from them. I always, if I got to choose who I wanted to be with, I always picked a CN, because I was like, you know, I don't know, it just felt good. It felt good to be able to like ask them all the questions and know I was going to get all the answers. Also, taking part in any of the hospital's education, you have access to do that as well. And being a student, because you're just an extra number on the shift, they'll most likely send you to education sessions. So yeah, that was really great too. 45 minutes, so I'm going to edit this and hopefully post it up today. But if you have any questions, like, leave them, ask them, find me on social media, ask me there. I'm an open book. I want to make this, you know, an easy, flawless experience for everybody. And I think by having that information and hearing it straight from the cat's mouth, is that a word? You know what I'm trying to say. It's my experience straight from me. So hopefully it helps. But anyway, I wish you guys all the best. I just hope that you guys going on placement soon, if you're here watching this in a year's time and it's because you're getting ready for placement, like, kill it, have the best time, put yourself out there, just enjoy it, embrace it, feel proud and confident that you're going into you know, like a hospital, like you finally get to do it, you know. And for me, it really cemented that I am just right where I need to be, and I'm so excited. So anyway, have the best weekend, and I can't wait to catch up with you guys again. Thank you so much if you've listened and watched so far. If you learned something awesome, make sure you give me a big thumbs up. If you are new here, please subscribe to my channel. I have lots and lots and lots of life experience and things in all of kinds of things. And I just like to have a chat and share my experiences with you guys to hopefully help, because I didn't have this when I was trying to become a student. So anyway, cheers to the weekend. Take it easy and go and get it, Tiger.
Hey.